Coronavirus Information Center. My name is Dasha. How may I help you?
Hi, Dasha. I just wanted to ask a few questions about the virus so I can make sure I was on the same page as everybody else.
Sure. Go ahead.
So, first of all, I'd like to know something about the virus case count in the United States and particularly in New York City.
Here's the latest case count in the U.S. as of today. There are 54,941 registered cases, 784 deaths, and 379 recoveries. In New York City, there are 26,348 registered cases and 271 deaths.
My goodness. Okay, it's spreading fast. What should I do to protect myself?
To avoid getting infected, clean your hands with an alcohol-based hand sanitizer or wash them with soap and water. You should also maintain at least 3 feet distance between yourself and anyone who is coughing and sneezing. Avoid touching your eyes, nose, and mouth. Besides that, make sure that you and the people around you follow good respiratory hygiene. Cover your mouth and nose with your bent elbow or tissue when you cough and sneeze. Then dispose of the used tissue immediately.
And what about masks? Should I use one?
No. The World Health Organization insists that you shouldn't unless you're already infected or caring for someone who is. And by the way, stockpiling masks makes it harder for nurses and doctors to access the resources they need to help on the front lines. I'd also like to tell you that masks, as a precaution, are effective only used in combination with frequent hand cleaning with soap and water or alcohol-based hand sanitizer.
Is this like a Christmas?
Okay, thanks.
Or what?
That's insightful.
Is that?
And how do I tell if I'm already infected?
Well, common symptoms include fever, a dry cough, fatigue, and difficulty breathing or shortness of breath. Some of these symptoms overlap with those of the flu. That's why detection can be difficult.
Well, how is it different from the flu then?
Unfortunately, there's no reliable way to distinguish between early symptoms of the flu and coronavirus as of today. What you should do is take a diagnostic test to determine which one it is. The CDC recommends that you call your healthcare provider and explain your symptoms and fears. They will decide if you need to be tested.
Okay, but one more thing. The authorities are urging us to stay home. Does that mean we can't go out at all? Like even to a park?
I'd say you should limit your trips outside except for essential needs. You can still go for a walk though, but try to do it in a way that keeps you several feet away from other people. You can still go to the grocery store, but do it about once a week if you can. And wash your hands when you come back home.
I think that's all I wanted to know. Thanks for the info.
You are welcome. That's what we're here for. Stay safe. Bye.